Hey guys, I want to talk about EMRs and how to pick the right EMR for the right practice at the right time, in the right place, in the right. Okay, so what's the deal with EMRs? I'm going to use two examples. Let's use the giant in the industry, that's WebPT. So a lot of people will ask, well, what's the best EMR for my business and who should I go with? And nobody can answer that question. It's the universal physical therapy answer to all questions. It depends. It depends on your practice, your business model. It depends on where you are in the growth. There's a big difference between somebody who's just starting out, who's doing maybe 5 patient treatments a week and has no staff, compared to a business that's got 10 physical locations. They're offering telehealth, they're billing in-house, they have an administrative team, a clinical team, all of this. There's just massive variability here. And I would say, even for your business, depending on your long-term goals, what's right for you now might not have been the right choice 5 years ago, and probably won't be the right choice in 5 years. So EMRs will change with time, and that is always my biggest concern. So let's take a typical scenario, WebPT and Therabil, and we'll compare that to Google Suites and PracticeMate. So WebPT and Google Suites, both of them would be intended for documentation. Both of them produce reports like the plan of care, the initial evaluation, treatment notes, progress notes, discharge summaries. That is essentially the medical record. Now, neither of them, WebPT nor Google Suites, G Suites, is capable of submitting claims to insurance. So both of them require a patient accounting software. PracticeMate is free through Office Ally. Therabil has a cost and integrates with WebPT. So information goes from WebPT, integrates into Therabil, from Therabil out to a clearinghouse, then out to the payer. That's the workflow in that scenario. You'll pay a monthly fee. You just have to figure out what that is. It varies based on volume and other stuff. On the G Suite side, so you would create the documentation in G Suites. It does not integrate into PracticeMate, so you would manually have to enter your claim information into PracticeMate. Then from PracticeMate, it would integrate with Office Ally. I can tell you on the PracticeMate side, as of today, Office Ally doesn't charge for the use of PracticeMate, but they do charge a $35 a month fee per rendering clinician to submit claims. So you do have that fee on that side. Now, my biggest concern, what I always look at to make a decision based on context, is who's doing the administrative work? How much administrative work do you have to do? If you're looking at spending 20 hours a week posting payments, entering claims, submitting charges, verifying coverage, doing all that stuff, and you're the owner-operator, you don't have an administrative helper, it might be worth $150 a month to have an integrated system. If you have the ability to hire on an admin person, and they're going to be handling a lot of those tasks, it may not be worth paying for an integrated system, and it may be better to have a more customizable system. When I look at long-term growth, my concern is always, where is my information? So I'm the practice owner, I'm the clinician, I want access to my patient's medical record. We know that you're going to switch platforms. When we started back in 2002. We started with an in-house system, just using paper notes. Then we purchased Redoc. Then we migrated to Turbo PT, I think it was. No, it was PT Advantage. We went to PT Advantage. Then we switched to a third platform. Then we came back in-house on a platform that I created. And as of today, we're kind of floating between G Suites and an in-house private server. But the idea is, every time we switched EMRs, it was nearly impossible for me to access my information for my patients. And even if they would export that information, they exported it in a format like a database style format, a comma delineated, whatever, that I just couldn't use, you know? So you have to understand that what might seem most appealing today might not be the right decision in 5 years. And so if you have 5 years of patient accounts on a platform, how are you going to access those? I don't think you want to keep paying a monthly fee to have access, but if you pull it off of that platform, what's the format going to be in? Is it going to be usable? Are you going to be able to get into it? These are the real questions and concerns that I would have, not just obviously what happens if the platform goes down, what happens if that business runs into financial issues or legal issues. You know, you're putting a big chunk of your business on somebody else's real estate that you don't own at the end of the day. And until payers absolutely require electronic medical records to be integrated, there just isn't that much of a benefit. You're looking to maximize efficiency. You're looking to reduce errors, human errors. Those goals can be reached through appropriate policies and procedures that you develop in-house. You know, if you find that you're missing, you're not getting your plans of care signed and returned, you develop a system to guarantee that it never falls through the cracks. You always have a system in place to check and double check and triple check that a certified plan of care has been returned for a Medicare beneficiary. If you find that you're receiving authorizations and your clinical staff or you are going beyond the approved number of visits, you develop a system that guarantees you never can bill beyond the authorized amount. There's always ways to do it, and the better you get at developing internal systems to correct errors that would have otherwise cost you revenue and time and headache, the better you get at creating those systems, those checks and balances, the better your business is going to be, and now you have an asset of real value, right? When we're talking exit strategy, when we're looking at long-term growth, why does somebody buy a McDonald's franchise? Because they're guaranteed profitability and they're guaranteed effective business systems. If you're not building business systems, you don't have a business. You don't have anything to sell, anything to pass on. You basically just have a job. So guys, let me know what your questions are. Let me know what you're thinking. This comes from a question that came in through text yesterday, and I finally got a chance to sit down, throw my phone up, and put out some information. Guys, as always, thank you so much. I'll catch you on the next video.